bringing together voices in child and youth healthcare. This is KC Presents.
KC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, the Holland Bloorview Children's Rehabilitation Hospital Foundation, the Children's Hospital Foundation of Saskatchewan, and Trillium Health Partners. We would also like to thank the following Keystone and program partners for their ongoing contributions that support all of CAFC's programs and activities. If you have any questions or comments for our panelists, please type them into the question box at any time during the presentation. You can also share your thoughts and questions on Twitter by tagging @CAFCTweets and using the hashtag CAFCPresents. All of our webinars are recorded and can be found on the CAFC Knowledge Exchange Network. Use the CAN to share these recordings with your colleagues or register an account and post comments, links, or other resources that you think will be of interest. And be sure to sign up for the KC Presents weekly email newsletter to stay up to date with upcoming webinars and our recorded webinar archive.
Hello everyone, and welcome to today's very special Valentine's Day presentation. Actually, it doesn't really have anything to do with Valentine's Day, but it is a happy Valentine's Day for everyone, hopefully, out there. I'm Doug Maynard. I'm the Associate Director at CAFC, the Canadian Association of Pediatric Health Centers, and today we're going to be talking about what have we tried and what works. We're going to be looking at a Canadian environmental scan of organizational supports for moving evidence into action in pediatrics. And it's going to be an interesting conversation. We have had many presentations over the years about KT or KM, knowledge translation, knowledge mobilization, whatever term you want to use to refer to this whole concept of putting some effort into ensuring research has the opportunity to put into practice. And what makes this particularly interesting is much of the conversation of late has been around sort of supporting the research end of things and helping the research community do a better job of translating research. But today we're going to be looking at more at sort of, I guess, the other end of the process and look at what organizations are doing through structures and supports to help staff improve their ability to find best practices and bring them to the bedside. So it's my pleasure to introduce our speaker today, who is Stephanie Glegg. Stephanie is an occupational therapist and is the Knowledge Broker Facilitator with the Child Development and Rehabilitation Evidence Center at Sunny Hill Health Center Sunny Hill Health Center for Children in Vancouver, where she facilitates evidence-informed healthcare among health professionals, leaders, students, and knowledge brokers. She also sits on the Child Bright Knowledge Translation Committee and is a member of the BC Support Unit's Knowledge Translation Methods Cluster. So without any further ado, it's my pleasure to hand the virtual podium over to Stephanie Glegg. Over to you, Stephanie.
Thanks very much, Doug. I just wanted to thank everyone for joining me on this fine Valentine's Day, and I hope that you share my love of evidence-informed healthcare and knowledge translation. But if not, hopefully you have some good chocolate to help you get through the webinar. It's an exciting day here in Vancouver because it snowed last night, but there happens to be a bobcat in our parking lot clearing all of the slush. So if you hear that in the background, my apologies. So today I'm going to be talking about this environmental scan that we're conducting on the organizational supports for moving evidence into action. And when I use the term evidence, I mean research evidence, as Doug alluded to, but also professional experience and the patient and family perspective and how those things might be integrated in a clinical setting to inform decision making, as well as purely from a researcher perspective, moving research into action. So just to acknowledge the funding support that has stimulated this project, that would be support from a Vanier Canada Graduate Scholarship, the Canadian Child Health Clinician Scientist Programs, Career Enhancement Award, and the UBC Public Scholars Initiative and Sunny Hill Foundation. So I'm very appreciative of their support in helping to move this project forward. Basically, to provide an overview of what I'll be discussing. So today I'll be talking about the methods for the environmental scan. So who we're seeking to invite to participate, where it's happening, when it'll be taking place and be completed, and why we're doing it, as well as the methods. How is it being conducted? And the what and the so what, so the findings and the implications of those findings will be saved for another day, mostly because they haven't been compiled yet, because we need your responses and those of your colleagues in order to be able to do that. So by the end of this session, I hope that you will know by whom and how the scan's being conducted, the research questions that inspired this project, how and when the findings will be shared and applied, and how you or your colleagues could participate. So the first is about who we are. So that's me on the left there. We're part of the Child Development and Rehabilitation Evidence Center, as Doug mentioned, and we're based out of Sunny Hill Health Center for Children, and our job is to facilitate evidence-informed healthcare here and across the province of BC in our role as a Tier 6 organization. And our team is quite small. Our manager is Dr. Kim Miller, and she's joined us in the fall. We also have a clinical librarian and an education assistant, and they're kind of the glue that hold us together. And then we have a couple of other people that have appointments with us, but no FTE with us, but our quality leader, Rita Janke, and our collaborative practice leader, Karen Derry. So they contribute to our work as well. So our thinking in doing this and conducting this scan was really to learn for ourselves how we could do better in facilitating evidence-informed healthcare with our stakeholders. So we do have a number of initiatives that support our clinicians, our leaders, our students, our knowledge brokers, but we want to learn from other centers about what they're doing, what's working, and what some of the challenges are. And we also want to share that information with all of you. So after going through the exercise to gather all the information, share it with other organizations who might be having similar goals to support the use of evidence in practice, so that we can celebrate the hard work that you're all doing in supporting evidence use, so that we can identify innovation that's going on across the country and explore new ideas that might inform the way we could be supporting evidence use. So partly motivated by a quality improvement perspective, but also to reach out to expand our network and look for new opportunities to improve our work. So why an environmental scan? We should probably start with what is an environmental scan. So our definition here is a systematic and objective method of reviewing research evidence, stakeholder perspectives, and current and anticipated policies, practices, processes, or protocols across sectors. So our sectors of interest here are pediatric healthcare organizations and research institutes. So we want to take a look at both. And we did start this process with a literature search, but we didn't find anything in pediatrics. And previous scans that we found were only carried out in a single province, and we wanted to tap into all regions of the country. So we're building on some of the work that's been done previously to try and target pediatric settings specifically, so that we can learn in a context-specific way. And so an environmental scan gives us a way to gather this information, because it's not published in the literature right now, and we can reach out to other stakeholders, which would be leaders and other people at these organizations, to find out what they're doing and how it's working. So some of the benefits of an environmental scan are understanding the broader context outside of our own little bubble, identifying trends and promising practices that we might want to adopt, avoiding pitfalls or challenges that others have faced, building a professional network of like-minded people who are working towards the same aims, developing collaborations and partnerships, particularly so that we're not duplicating work, and creating an evidence-informed action plan. So by the end of this, we hope to have a strong idea of what supports for moving evidence into action are in place across Canada, and where each of our organizations might want to go next in terms of strengthening those supports. So my next slide is about our research questions, what we want to learn through this environmental scan. So we're primarily interested in what types of organizational supports exist for moving evidence into action at these healthcare organizations and research institutes. And as I mentioned, that evidence is not limited to research, but that may be a major focus. We also are interested in how the clinical experience and patient and family perspective are integrated as well, and how they're supported to be integrated. We're interested in how stakeholder engaged research is supported. So that would be patient-oriented research. It might be involving other stakeholders like industry or government, any type of stakeholder who's involved in research, and how that process is supported within these organizations. And finally, we're interested in how research is supported in clinical sectors. So that can often be a challenge because our resources need to be prioritized for clinical care. But there are so many benefits to engaging clinicians in research and having research right in the clinical sector. So we want to identify ways to support that so that we can enhance that at our organization. So the types of supports that we're talking about here are things like resources. If you have internally developed resources or external resources that you access, tools, clinical stuff, it could be any type of resource. If there's any infrastructure that you've implemented, specific processes to support these objectives, personnel to support them, and any partnerships, which could also be internal to your organization across departments or something like that, or they could be with external partners, and how those support these three aims. We also want to know from your perspective what works, and then what some of the challenges are in supporting moving evidence to action in these types of research collaborations. And then finally, if you had all the money in the world, what additional supports would you put into place, or what gaps do you perceive are not being met by the supports that you currently do have in place? To give you an example of some of the questions that we are wanting to answer, that we're asking in our survey, we're interested in things like how library services are structured within your organization, whether it's a physical library or a virtual one, any non-library services for things like supporting the appraisal of evidence, adapting it to the local context, applying or implementing it, evaluating evidence use, which supports exist to engage patients, families, policymakers, industry, or other groups in research. So those types of things. Doug, this might be a good time to stop for questions if there are any.
Nope, there have not been any questions yet, but that is my chance to remind everyone in the audience, if you do have a question, please do type it into the question box at any time, just so we have it ready for when next time we pause for questions, we'll have them all ready. So just type them in as you think of the questions. Thank you.
Great, thank you. So next I'm going to just overview the methods that we're going to be using, or we have already started. So we started with a scoping literature search. And as I mentioned, we didn't find anything specific to pediatrics, and things were more regional rather than national. And we wanted to get a good snapshot of what's going on in all regions of the country. So that's been done. And right now we're on our online survey process. So our goal here is to gather, general information from, there's over 30 organizations that we're hoping to engage in this survey to gather the information that I just mentioned. And then we do plan to do some interviews with particularly those organizations that have dedicated teams or units for supporting evidence-informed healthcare or knowledge translation, just to get a better, more detailed look at how that's structured and what the approach looks like. And then in the end, once all this is done, we do already have a literature synthesis. So this isn't a systematic review or a scoping review that will be published in the literature, but rather, a stakeholder-friendly synthesis of the literature that just formed the basis of designing the survey and the interview questions for us. We also plan to write up an article for publication on the process, and then we'll create an executive summary that we can share with healthcare leaders and research institute leaders and other people who want to quick and, straight to the point summary of our findings. We hope to present at a conference to share this with other researchers and other stakeholders at those conferences, and whether that's CAFC or some other forum has yet to be determined, but you can stay tuned for that. And then probably we will be providing another webinar or telehealth video conference down the road where we present those findings so that we can reach a broader audience than just those who might be at a conference. So our timeline here would be to wrap up the survey and the interviews this spring, and then have the knowledge products and presentations and things ready for the fall. And I should mention that the results that we'll be gathering will be aggregated and anonymized whenever we present the work. So our point here is not to highlight who's leading the field and who's lagging behind. It's really just to map out the landscape of supports that exist, to create sort of an inventory of approaches that are being used, which can allow organizations to explore them as potential options. And Doug, you'll jump in if there are any questions.
Was a question did come in. They were just asking if they how they can access the online survey. I was going to mention that we did have a blog post that went out. So on the CAFC Conversations blog, there is a post there that describes this work and has a link to the survey. And I can put the link in to that survey in the chat box in just a second once I find it, so that everyone can have access to the survey.
Great. I do have it linked at the end of this presentation. I'm only a short way away from sharing that link on here as well, but it would be great if you could put it right in the chat box for people to access. Okay, so who can take part? If you're curious, if you qualify or someone else that you work with, we're again targeting pediatrics. We're hoping to engage academic health science centers, which would be similar to our institution, any hospitals and rehabilitation centers that do work with children. So even if you are adult-based, but you have some pediatric services, we're not going to turn away any respondents. And then also affiliated research institutes, so with these organizations. And that doesn't matter whether your research institute is on-site with you or off-site. As long as you have a relationship with them, then we're interested in connecting with them as well. And any support to link to research institutes would be really appreciated for us as well. So the types of respondents we're looking for are directors of clinical services and supports, so kind of directors of organizations. Sorry, there's
the main door to Glegg building.
Forgot to mute the overhead.
Please open the main door to Glegg building.
Okay, directors of research services, either clinical settings or research institutes, managers or directors of grant facilitation offices, and anyone involved in a team that supports knowledge translation or evidence-informed practice. Managers of libraries, whether they're virtual or a physical space. Leaders of education, leaders of quality improvement, and directors of professional practice. So those would be those people who oversee the different health professions within an organization. If you're not one of these people, but your organization has KT or evidence-informed practice supports of any kind that you'd like to have included in our scan, please let these leaders know, or you can answer the survey yourself if you think that's the best way to ensure that we get the information. And we also might be missing some types of people from this list. So if there's someone you know who knows about these types of organizational supports at your institution, we would really value their input. So please pass the word on to them. And what we've noticed in our work here is that there are lots of pockets of innovation within an organization. And so what might be going on in one department or one profession or one team might not be happening in other places, and those other places might not be aware of it. So for this environmental scan, we decided to recruit or invite more than one respondent from each organization. There's really no limit to the number of people from an organization who can respond. And so that would give us a broader idea of what's going on. And duplication is okay in this sense. It'll be our job to tackle the data analysis to iron out a picture of what's happening. But the more information, the better. So here's your question. How do you participate? So to take the survey, there's a shortened link, and Doug might have shared the long link as well. I'm not sure, but either one will take you there. I've had in our organization the first two letters of this shortened link autocorrect to switch places to make it WO instead of OW. So if you are manually typing that in, just double check if you're getting an error that those letters didn't switch on you. You can also just scan that QR code and it should take you right to the survey. I think it should work on the webinar screen. So the survey itself can take anywhere from 5 minutes to 25 minutes or so, and that there's 5 different sections in the survey, and so you get to select which sections you want to answer based on your knowledge of the organization. So if your expertise is library supports and that's the thing that you want to check, then you'd be finished in 5 minutes or less. If you're more aware of a range of different types of supports, then you might have additional questions to ask, and really any response and input that you can provide would be really valuable for us. If you include your email address in your survey response, then we can follow up with you either to clarify responses or to invite you to participate in an interview later on in our process to discuss your approach in more detail. And for those Francophones in the group, our French version of the survey is in process, and our goal is to have it ready for you by Monday. So you can email me if you have any questions about that. The second way that you can participate is sharing this link with your network. So we have tried to fan out the survey link to people in our professional network, but we're not as connected as all of you. And I'm sure that each of you probably has at least one colleague who would have some knowledge about organizational supports, if not you yourself. And we would really appreciate you sharing spreading the word about the environmental scan so that we can get some really good data and we can all benefit from that information to help inform our work. So here's my contact information. You can tweet me, you can email me, and our Sunny Hill Evidence Center Twitter handles down there at the bottom too. And we'll be tweeting out the link to the survey over the next couple of weeks to encourage people to take part. Are there any other questions that have come up, Doug?
All right, so that there are no questions right now, but if anyone does have a question or is trying to type it in, please do so, and we'll get to it. I did put the polls into the system. If you wanted to run those polls now, just to get a sense of how people were hearing about this and how the fan out process was working for you. If you'd like me to run those now.
Sure, that would be great.
All right, so while everyone's sort of typing in or thinking of questions for Stephanie, if you want to just take a minute to just click your selection on the screen, and you can select more than one response on the screen. So where you're just wondering how you heard about the KT support environmental scan. And we did have to shorten some of your responses, Stephanie. We only have room for 5 response choices, so we had to sort of modify the question a little. But
okay.
It looks like most people heard about it from the CAFC newsletter or blog, hence the reason they signed up for the webinar today. At 63% said they heard it from one of those 2 places, 38% from an email from a colleague or a network, and 13% directly from you. And fortunately, no one said this is the first time they're hearing about it, so that's good.
Excellent. Thank you.
And as far as why did you join us today, if you could just let us know why you joined today after you heard about it, to learn why the scan is being conducted, to learn how the scan is being conducted, to hear the results of the scan. I always attend the CAFC Presents webinar. Fingers are crossed for that one. And I'm interested in how evidence is moved into action. We'll close that off, and everyone said they're interested in how evidence is moved into action. We had 13% sucking up on Valentine's Day, saying they always attend the KFC Presents webinars. 30% to hear the results of the scan, and 25% to learn why the scan is being conducted, and only 13% about how the scan is being conducted. So that's some interesting results there. So if there are no more questions, it may be a short but sweet session on for Valentine's Day. So Stephanie, is there anything you'd like to share with the audience before we wrap up? If there are if there are any last minute questions, please do get them in as quickly as you can. But if there aren't any more questions, Stephanie, if you'd like to just sort of any closing messages you'd like to leave the audience with before we wrap up.
Yeah, no, I just wanted to thank you for joining today. And again, if you have any questions at all about what's happening with the scan, or if you want some information in written form that you can circulate to a colleague that would explain what's going on with the scan and inviting them to participate, then please just drop me a line and I can forward that to you to circulate. And enjoy the rest of your Valentine's Day.
All right, and with that, I guess we will close it off. Thanks again for joining us today. We do our webinars every Wednesday at 11, and it is a great opportunity to ask questions when you do join live. But when you can't join live, we do record the sessions, of course, and make them available afterwards on the Knowledge Exchange Network. Next week, on February 21st, we will have a webinar where we're featuring our colleagues from the McMaster Children's Hospital in Hamilton, who are going to talk about the PICU Liberate, the ABCs of recovery. In this session, they're going to talk about the journey that McMaster Children's, their PICU, has taken to implement an 8-part pediatric care bundle to help liberate children from experiencing common and often preventable PICU acquired morbidities, such as delirium, withdrawal, weakness, and malnutrition, which can contribute to lingering effects and symptoms well beyond the PICU discharge. So that's going to be an interesting presentation for our acute care colleagues who deal with children in the ICU. And then following that, on February 28th, we're going to hear about a critical incident stress management program, a contribution to a healthy workplace. And this session is going to feature our colleagues from the Alberta Children's Hospital in Calgary, where they will discuss their program to help address the symptoms of PTSD, moral distress, compassion, fatigue, and burnout that we are recognizing as being far too common of an issue in the acute care setting. The development of this CISM program is to support staff with managing the heavy load of complex, ethically challenging, and potentially traumatic cases, such as non-accidental trauma, organ donation, unanticipated deaths, resuscitations, and end-of-life care. So a couple of very interesting sessions coming up, particularly for our ICU colleagues. So hopefully we'll see everyone back here next week. And with that, I hope everyone has a great Valentine's Day. Bye, everyone.